My name is Dr. Chan. I'm Dean of Admissions here at the University of Utah School of Medicine. Today I'm here to talk about joint degree programs at our school. All right, I'm going to talk about MD PhD a little bit later, but I just want to mention it because there's actually two ways of getting into our MD PhD program. There's a joint application process at the beginning, or there's a sequential or separate application process. So if you are a current medical student here and you are bit by the research bug, you just really want to do research, you can apply as a medical student to switch from MD track to MD PhD track. All right, so I just mentioned here briefly, just so you know, there's two ways of onboarding for the MD PhD program. Okay, so MD MPH, Masters in Public Health. What is this? So this is a 5-year degree, and these are for individuals that are going to, they're very interested in public health initiatives or preventative medicine, looking at vaccine rates, rural care, utilization, things like that. Okay. So you can do a Master's of Science of Public Health or a Master's of Public Health, and there's a lot of flexibility. This can be done after the first, second, third, or even 4th year med school. What's the difference between the MSPH and MPH? The Master's of Science of Public Health has a greater research emphasis. You have to do a little bit stronger research to get the MSPH compared to the MPH. All right, MD MBA, Master's of Business Administration, incredibly important. There are more and more healthcare economics, finances, where are we going as a country, insurance, reformation, things like that, really, really important. And some of our students come with a background in business and want to grow that. So again, this is a 5-year program. Students do their first 3 years in the School of Medicine, and they step off for a year, do a year of master's coursework at the David Eccles School of Business, and they rejoin the med school for their 4th year. So again, 5-year program. Not as much flexibility. There have been some discussions about opening this up more, maybe doing after the 2nd year, but for right now, it's only after the 3rd year. All right, Masters of Science in Engineering, an MS. So this grows directly out of our Bench to Bedside initiative. I talked about this earlier, but essentially Bench to Bedside is our way of shortening the gap between bench research and helping patients more quickly. It's a really fun competition we do. It's multidisciplinary, different medical students, engineering students. They brainstorm, they put together projects, and these projects get judged in an annual competition called the Bench to Bedside Gala. And the winners get capital or seed money. They get to go off and be wined and dined by venture capitalists. They get help from our law school to file patent protection. This is a really cool endeavor. So we noticed that the med students, not all of them, but the ones that won, tended to want to take off for a year and kind of develop their project more. So this Master's of Science Engineering grew out from that. So again, it's a 5-year program. You don't have to win Bench to Bedside to participate. But again, it's another way of showing you how at our med school, we really try to have our med students have as many options open to them. So our core group of students are very interested in this year after year. So if you don't see it here, you talk to our student affairs. We try to be as flexible as possible. So if you want to take a year off in the middle of medical school and do research or pursue a different degree at another program, if you want to do an MPH at a different school, you just talk to student affairs and we can work that out. All right, I hope you liked learning about our different joint degree programs here at the University of Utah School of Medicine. I look forward to seeing your applications. Thank you.